President Trump and Congress's latest big, beautiful budget bill has left millions of Americans in shock as it threatens to strip healthcare from those who need it most. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202 838 6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, health policy expert Linda Benesch dives into the details of the proposed budget and explores the potential consequences of such drastic changes to our healthcare system. From Medicaid cuts to the impact on rural communities, we examine the far-reaching effects of Trump's budget plan and what it could mean for the future of healthcare in America. Stay tuned for a thorough breakdown of the proposal and its implications. Welcome, Linda.
Thank you so much for having me on, Laura. I wish it was for a better reason.
Thanks for joining us. And just to get people up to date, the bill has passed the House and it's moved on to the Senate. What else can you tell us about the timeline and how all this process works?
Yeah, so the bill, it goes now to the Senate, and um, most experts think that the Senate is likely to modify it. But what's interesting is there's some countervailing pressures in the Republican caucus where some of them are saying, oh, this bill is too expensive. We want to save more money. And so there are Republican senators who are actually really upset that the enormous cuts to Medicaid, healthcare, food assistance in this bill are not even bigger. And so they're going to be pushing for larger cuts. But then, meanwhile, you have some Republicans who are either up for re-election or what passes for moderate these days, or who have said that they don't support such big cuts to Medicaid. So they'll be pulling and pushing in the other direction. And, the Republican, the leader, John Thune, are going to have to reconcile that. We also will have to see what role President Trump, who is always a chaos agent, might play. But I mean, what we do know is that however they modify the bill, it's still going to fundamentally be a huge tax giveaway to billionaires, paid for by massive cuts to Medicaid, Affordable Care Act, other healthcare programs, and food assistance. And so it's going to be a big, ugly bill when it comes out of the Senate, just like it was when it came in. But then, as long as the Senate makes any changes to the bill, which is very likely, it's going to go back to the House, and the House is going to have to vote on it again. And the Republicans say that their goal is to get this to Donald Trump's desk by July 4th. So there's going to be a lot happening in the next month.
Thanks. And so let's talk about what's actually in the bill right now that the House passed so that people know how this could affect them and their community. First, the thing that we've talked about a lot are the Medicaid cuts. Can you sum up what that looks like?
Yeah, so this bill would cut roughly $7.16 billion from Medicaid. Up to 15 million people could lose their health care coverage, and that includes Medicaid. And it's really going to be devastating for communities across America, even for some people who don't have Medicaid, because the cuts are going to be so big that hospitals in rural areas and inner cities in particular that are really reliant on Medicaid payments for a lot of their funding are going to be forced to close. So 200 rural hospitals have closed in recent years already, and we're likely to see hundreds of more closures across the country if these Medicaid cuts go into effect, and nursing homes as well. And so what this will mean in practice is people who have to drive, potentially hours more for the healthcare that they need, caregivers and loved ones who can't send their relatives to a nearby nursing home. They might have to go far away if they can even find care at all. Since I'm at Social Security work, so what we follow most closely is the impact on seniors. And that would really be enormous. Like, people associate older Americans with Medicare, but in fact, Medicaid plays a really huge role too for covering healthcare for older Americans. It pays for over 60% of nursing home care in America. It also covers other types of long-term care like in-home care, and it covers premiums and out-of-pocket costs for a lot of people with Medicare who are dually enrolled in both Medicare and Medicaid. That's millions of people. And so This would be really devastating for older Americans, people with disabilities, children, families across America.
Not only would these cuts affect people directly if they're on Medicaid or someone they know and love is on Medicaid, as you mentioned, rural hospitals would close. Healthcare infrastructure that everyone benefits from would suffer. But also, I think people should know that if you take away Medicaid from millions of Americans, they don't stop needing that health care.
Yes.
And so, if people show up at the hospital where their illness or injury has become much more severe, that uncompensated care is something that we all will pay for. If you have insurance through another means, the hospital, if it's going to stay open, needs to get its money from somewhere. Medical providers need to get paid somehow. So if they're treating people without insurance, that means everyone with insurance will pay more.
Yeah, that's exactly right. I always say to people, if you want to hear about how bad this bill is and you don't want to listen to Democrats, listen to hospitals. Like the leaders of some of the country's leading hospital associations who are not, just like ideological or reflexively lefty, they say that this is going to impact all patients, not just Medicare beneficiaries and communities across the nation. Um, and that this would just be absolutely devastating for hospitals and for the whole communities that rely on them.
Our healthcare system, regardless of how you get your insurance now, would be taking a direct hit with these cuts. So we've covered Medicaid. Let's talk about how the Affordable Care Act and even Medicare will be affected.
Yeah, and so the Medicare part, this is new. But basically, this bill, the tax cuts for billionaires are so enormous that even these Medicaid cuts that are also huge don't pay for them, which means that this bill would add a lot of money to the deficit, and that triggers an automatic provision that leads to Medicare cuts, 500 billion of them. And this is one of those things where like the media isn't taking it super seriously at the moment because Republicans could theoretically pass another bill later that would make the Medicare cuts not happen, but there's no guarantee that they're going to do that, right? I mean, these are the people who are about to take Medicaid away from millions of Americans, and they really just can't be trusted to clean up the mess that they've made. And so I think that, Medicare beneficiaries and everyone who cares about them should be very concerned too. And this would also compound the effects of the Medicaid cuts because a lot of those same hospitals that rely on Medicaid payments, a lot of the rest of their funding is Medicare payments. And so they would be even more likely to close and leave whole communities without health care.
Can you talk about what half a trillion dollars of Medicare cuts looks like? How would that affect people on Medicare now?
So I think it would mean that a lot of like the doctors and hospitals that they currently go to would stop accepting Medicare patients because they would no longer be able to reimburse those providers with what they need to make it worth seeing patients. And so people would lose the doctor of their choice and the access to the healthcare that they need.
So the bad effects of this budget bill will continue to ripple out. And now it's not only Medicaid at stake, but the Affordable Care Act, premiums would go up. People would lose care because it cuts down on how you can enroll in plans and Medicare itself. So this direct blow to the healthcare system doesn't have to happen, right? Even though a bill has passed the House, the Senate can do their own thing. They can make changes. They cannot pass a bill at all. Or even they could choose to expand healthcare instead of take it away in the Senate's version of their budget rules. So, talk about what the Senate could or should do.
Yeah, so if the Senate, if they really wanted to find savings in healthcare, the best way to do that is to go after Medicare's so-called Advantage plans. And these are privatized Medicare plans that charge the government a lot of extra money and then turn around and provide worse care to patients. And there have been independent reports that show just massive amounts of money that they're stealing from taxpayers every year. And so you can find like trillions in healthcare savings if you just stop letting corporations rip us off. And so that's what they should do. And then while they're at it, they should consider making millionaires and billionaires pay their fair share in taxes instead of giving them additional tax cuts that they don't need.
Instead of trying to take away health care from millions of people to pay for these tax cuts to billionaires and greedy corporations, what they should be doing is looking at the corporations that are ripping us off. Like you said, billions, even trillions of dollars over the years that are just going to pad their own profits. Instead of taking healthcare away from people, they should take money away from the insurance fraudsters.
Yeah, that's exactly right. And then while they're at it, we should also stop letting Big Pharma rip both consumers and Medicare off, which would save both regular Americans and the government a lot of money. Let's expand what President Biden did to let Medicare negotiate lower prices and take on Big Pharma.
So, if people are upset about what's in the bill right now, what can or should they do about it?
So I would encourage people to call both of your senators and your member of the House of Representatives, since both chambers still have to vote on this bill again. And also like look and see if groups in your area, Indivisible, 5051, are doing any local organizing against the bill. And if you can't find any, consider organizing something yourself, especially outside local hospitals and community health centers. We're working with a lot of groups around the country who are doing rallies like that. And so folks can also go to socialsecurityworks.org and follow us on social media for updates. But the next month is going to be really critical. These members of Congress need to be feeling the pressure in their districts. They need to know that people are paying attention. And what we found is that, when they actually have to hear from people, they run away or they say just the most ridiculous things. So we had two Iowa members of Congress, one of them, Marianne Miller Meeks in the House. Our executive director, Alex Lawson, ran into her in the halls of Congress and asked her about the Medicaid cuts. And she literally ran away. She was mashing on the House elevator button, the members only elevator, because she couldn't get away from him fast enough. And then in Iowa itself, we had a constituent ask Senator Joni Ernst about the Medicaid cuts in the bill that could kill her. And Joni Ernst replied, well, we are all of us going to die. And so that's the only answer that they have when constituents actually get in their face and ask them about this bill. Like what they want is to do it under the cover of darkness, under the cover of Trump's chaos without people noticing. But if people are actually paying attention, then these members of Congress, they get scared.
Well, thank you very much for joining us, Linda, especially since Alex was not able to make it. And everyone, follow Social Security Works for more updates, especially on Medicare.
Thank you for having me.
And now, Louise Norris from healthinsurance.org and Diane Archer from Just Care will answer some of your viewer questions. So let's start with a text that came in from a viewer that said that I have Clover Health PPO. Is that the best plan for me? Only disease is Parkinson's. And we will give you advice, but without knowing more details, we can't prescribe any particular health insurance plan. And there are others that can help you more. But just some general thoughts. Welcome, Diane from Just Care.
Thanks, Louise. Thank you. I think this is a really, really important question, and I wish that I could give you a really smart answer. But the problem is that whether you have Clover Health or any other health plan, it is impossible to know whether that health plan is going to meet your needs. And that's because the information you would need to make a smart choice of a health plan is not available. So one of the big issues is Does your health plan actually cover the care that it's supposed to cover? Does it do it in a timely manner? And does it allow you to see the doctors and hospitals that you need to see and that you want to see? Clover Health is a Medicare Advantage plan, which is just a health plan that's run through Medicare by a corporate health insurer. And the only thing we can tell you about Clover Health is that the Medicare program ranks it with stars, but those star ratings, even a 5-star rating, can be a farce. And my understanding from a quick Google search is Clover Health only has a 3.5-star rating, but a 5-star rating can mean the plan still delays and denies care. And according to the Office of the Inspector General, it is widespread and persistent for Medicare Advantage plans like Clover Health to inappropriately delay and deny care. So avoid plans, I would say, with 1, 2, and even 3-star ratings, because those have been shown by Medicare to be bad. But the 4 and 5-star plans or 3.5-star plans could still not be giving you the care you need. The other issue to think about is that while you only might have Parkinson's today, insurance is about tomorrow as well. And you don't know whether you're going to fall and have a serious break of your hip, or you're going to end up diagnosed with some serious disease in the next few days or coming months. So what you want to do is have a health plan that meets your needs not only today, but also tomorrow. And again, with these Medicare Advantage plans and with all health plans, whether it's through Medicare or in the individual market, there's just no telling whether the plan is going to cover the care you need from the doctors that you want to use. Now, having a PPO, which is what you say you have, a preferred provider organization, is much better than having an HMO in terms of access to providers. So if you're in an HMO, you have a very restricted number of doctors and hospitals that you can use. Usually it's only doctors and hospitals in your community, except in emergency or urgent care situations. With a PPO, you are covered for out-of-network care, which is good. It gives you more access to doctors and hospitals and even access outside of your community. But that also doesn't guarantee that you're going to be able to see the doctors that you want to see, because doctors are not obligated to take you if you're in a PPO. And moreover, if you're in a PPO, you're going to be forced to pay a lot more out of pocket than you would pay if a provider is in network. And so that can be another obstacle to care. So just as an example, from experience, I know that Memorial Sloan Kettering in New York, which is the preeminent cancer center, hasn't accepted almost any Medicare Advantage plan for people in PPOs, and there's no requirement that it do so. Now, maybe it does now, but everything is always shifting, and you can never be guaranteed access to the providers you want to see. Lastly, I want to mention that you can go to the Medicare Plan Finder, which is online, which can help you see differences among the Medicare Advantage plan options that you have. So the problem there, again, is that it won't tell you whether your Clover PPO or any other Medicare Advantage plan will actually pay for the care it's supposed to pay for. For example, some Medicare Advantage plans are known not to cover rehab services or skilled nursing services. They'll wrongly deny these costly services, even though they're supposed to cover them. And you won't learn that from the Plan Finder. So it's hard to rely on that Plan Finder to make a decision about a Medicare corporate health insurance plan, a Medicare Advantage plan. You do have one other option, and that's the traditional Medicare program during the open enrollment season. And the advantage of traditional Medicare is that it gives you access and coverage from doctors and hospitals across the country, and a much wider array of doctors and hospitals than you get in Medicare Advantage. And another big advantage of traditional Medicare is that you don't face the same prior authorization obstacles that you face in Medicare Advantage, or the same inappropriate denials and delays of care. So for all those reasons, if you want to have a much greater chance of getting the care you need when you need it from the doctors you want to use, you want to be in traditional Medicare. But there's a caveat. And that caveat is that traditional Medicare, unfortunately, does not have an out-of-pocket limit. And that's a problem, because if you join traditional Medicare and you don't have supplemental coverage, either through Medicaid or through coverage you buy in the individual market or through an employer, then you could get stuck with really high out-of-pocket bills. And so that's one big hitch. And the other hitch is that insurers don't always have to sell you that coverage. You have a guaranteed right to buy it when you first enroll in Medicare, and for the first year. If you join directly in a Medicare Advantage plan, you can leave that plan and still go back into traditional Medicare and buy supplemental coverage. But after that, it's really in the hands of the insurer to decide whether you're allowed to get that coverage, and to some extent what you'll have to pay for it, except in 4 states: New York, Massachusetts, Connecticut, and Maine. So that's a long way of saying, I wish I could help you here, but unfortunately, it's a bit of a crapshoot whether the Clover Health PPO will meet your needs, or any other Medicare Advantage plan will meet your needs. It's going to depend a lot on particular circumstances.
Thank you, Diane. And to add to general guidance on picking a health plan, welcome Louise from healthinsurance.org.
Thanks, Laura. So like we said, Clover is a Medicare Advantage plan, but people who purchase their own health insurance in the individual market also run into similar questions. And so there are some additional things to keep in mind if you're buying your own health insurance. So you do want to start at healthcare.gov. If your state doesn't use healthcare.gov as their marketplace, the healthcare.gov site will direct you to the website that your state uses. It might be Covered California, for example, New York State of Health. About 20 states use their own platforms. But if you start at healthcare.gov, then you'll have a no wrong door approach. All individual major medical plans that are sold anywhere in the United States have to comply with the Affordable Care Act, but there are lots of non-ACA compliant plans that are sometimes disguised, depending on the website you are looking at. Maybe it's a short-term health plan, maybe it's a fixed indemnity plan. These are not real health insurance. They're not compliant with the Affordable Care Act. And if you just start Googling, looking for health insurance, you might find yourself on a website that's selling those sort of products instead of real individual health insurance. So starting at healthcare.gov is a good way to make sure that all the plans you're looking at are ACA compliant. The open enrollment window for switching plans starts November 1st nationwide. Over the last few years, it's continued into at least the middle of January, but there are proposed rule changes that would end it in mid-December this year if finalized. So I would advise, if you're considering shopping for new health insurance this fall, that you realize it starts November 1st and just plan to be finished with the process by December 15th, just so that you know that your new plan would take effect January 1st. You do want to make sure that your doctors and hospitals are in network, and this changes over time. So you don't want to assume that just because they were in network last year that they still will be next year. You also need to know that insurance companies create networks that are specific to the individual market. So you may have had a plan through an employer with a certain insurance company. You don't want to assume that the same doctors and hospitals will be in network if you buy that insurance company's individual market plan, because they do create separate networks. So we always advise that you check the insurance company's plan finder tool, or sorry, the insurance company's provider finder tool, but then also double check with the provider's office, because there are sometimes errors. Sometimes, a provider is leaving the network or joining the network. You just want to double check that with both the provider and the insurance company. And then you also, when you're looking at these plans, you want to look at total costs. Usually the default is that you'll see the plans ordered from lowest premium to highest premium. But you need to also be looking at deductible and total out-of-pocket costs. Depending on what your medical needs are, you might just know that you're going to meet the maximum out-of-pocket if you have a serious health condition. But even if you're perfectly healthy, like Diane was saying, you shouldn't assume that your health needs are going to stay the same a year from now as they are right now. You might be perfectly healthy now and have no expected healthcare costs, and you could get diagnosed with cancer 3 months from now and all of a sudden be looking at hitting the maximum out of pocket on the plan you have. So you do need to take that into consideration of knowing that a plan might seem very affordable in terms of premiums, but would you be able to pay the full out-of-pocket costs on that plan if a medical condition were to arise? So those are all factors to take into consideration.
Thank you, Louise. And our next and final question for today is from Dawn on Facebook, who was responding to a previous episode with a question on how prescription drugs at your local pharmacy could be cheaper without insurance. And Dawn mentioned that there are also discount plans that are sometimes cheaper than the insurance copay, like single care. Diane, can you talk about that?
Sure. Yeah. So yes, yes, and yes. Unfortunately, the Part D plans have the ability to charge copays that are higher than the cost of a particular drug from certain other channels in some cases. And that is just a crazy thing that they're allowed to do. And so if you go to the pharmacy to pick up your drug and you find that the price seems high, or even if you don't, it's always wise to ask the pharmacist if you can get that drug at a lower price, which seems like a really silly question, but the pharmacist won't tell you that you can unless you ask. And sometimes, believe it or not, and I've had this happen to me, it does happen that the pharmacist will say, oh yes, through this other coupon system that they have on file, I can get you the drug for half what you would have paid or I would have paid on my Part D plan. So that's a way to go. Another way to go is mail order for lower prices. And then people say also that Costco can provide lower prices. I know pharmacychecker.com is a fun place to go, pharmacychecker.com, which provides you with information on the price of drugs from verified pharmacies. They've checked all the pharmacies around the world, and you'll see much, much, much lower prices if you go there. You'll have to wait for your drug, sometimes a few weeks, but it can be really worth it if you plan ahead.
Thank you, Diane. And like you said, pharmacists aren't always even allowed to volunteer this information, but you can and should always ask, is there a cheaper way to get this medication? And they may be able to help you out with coupons, or maybe it's even cheaper without using insurance.
Mm-hmm. Mm-hmm.
So thank you, everybody, for joining us today for Care Talk. To learn more about the federal budget and proposed cuts to our healthcare, please text or call in your health insurance and healthcare questions to 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.